Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist, and in today's video, it is part 2 of our wrist tendinitis management video series. So today we're going to be talking about the general treatment principles of wrist tendinitis. If you missed the first video, go ahead and check that out. I've posted the link in the description below, so check that out first. And just a reminder, there are going to be 7 videos in this series, so make sure that you subscribe so that you don't miss any of this 7-part video series. Okay, let's get into it. So first things first, I think that it's very important to set up patient expectations of their condition, educate them about the condition, what it means, and give them some expectations or reality of how long this might take to heal. Typically, wrist tendinitis is a gradual onset. It can sometimes be traumatic, but it's more common to be a gradual, progressive onset due to increased loads, repetitive stresses, awkward positions, and the tissues take time to heal. So I typically will tell patients it will start feeling better after consistency of your home program, everything that we're going to talk about, educate you about. You have to be consistent with those things for 4 to 6 weeks to see a change. But know that there will be some activities and some movements and some things that will cause pain, very likely, for 9 to 12 months as the tissue heals. Sometimes it even takes longer than that, right? It depends on how consistent we're able to be, and other factors, certainly. If you work in a really heavy job, you're probably not going to be able to completely modify those activities. That might be just prolonging the process, right? So I do think that that part is very important to educate patients and set them up with their expectations. And I think as therapists, we need to be really looking at why this problem has occurred for the patient. So is it something to do with repetitive work activities or hobbies, things that they do at home? Are their body mechanics really off or awkward? Is their posture out of line? Do they have some sort of dyskinesis or some atypical kinetic pattern that's causing repetitive strain or overload on some of those tissues? So that way you can tailor your treatments and your interventions to each patient individually, which is really important for hand therapists and all therapists in general. So what are some of the actual interventions that we can do for wrist tendinitis? First off the bat is modalities. So that includes things like hot and cold modalities, low level laser therapy, ultrasound, TENS or electric stim. Any of those things that are, typically common in the hand therapy or therapeutic world, they can be very helpful in pain management on a temporary basis, right? You can't think that you're going to ultrasound someone once and they're going to have no pain ever again. But I think that relieving pain, even in a temporary circumstance, can be very helpful for some patients. So it's something definitely to consider. I do like to educate patients on how to perform some of those strategies at home as well, because we know that the healing process is probably going to take several months at the very least. And we're not going to be there at home with them for, 6 to 12 months, right? Like we might get to see them for a couple months, maybe a few weeks. But that's just the way the world works in healthcare. We don't see people for that long. And we want to empower our patients and educate them, give them the tools that they need, and guide them on how to make their condition better over time, not to be dependent on someone else, but finding ways that they can help relieve their own pain. So I would encourage every therapist to look at evidence. Evidence-based practice is very important. So just make sure that you're kind of looking at the research, the literature that exists, and also clinical practice, right? That's also an important part of treatment, not just the research studies, but what you've learned in practice and what you've seen in practice to help patients. So that way you can determine if a modality or any particular modality is going to be an appropriate part of the treatment plan for each individual patient. Next up is manual therapy. So again, something that is very commonplace in the hand therapy world. That can include soft or deep tissue mobilization. It can include ISTIM, which is instrument-assisted soft tissue mobilization. It can include fascial or connective tissue mobilization, right? Things like kinesio tape or fascial gliding, working with the skin and scar. It can also include joint corrections, right? Joint mobilizations or positioning. Manual therapy can be a helpful way to soften or stretch or release tight musculature. It can help with stiffness. It can help improve blood circulation or flow. It can reduce tension on the skin and the other structures. And it can also help with relieving pain, which again, temporary, right? I always tell patients, you get a back massage, you feel better for a couple days, but then the weight of the world continues to crash down on you. And so, one back massage is not going to give you permanent relief, but it's something that you can do, another tool essentially for your toolbox or your kit to help you feel better and to help you, to empower you, right? To kind of do things that make you feel better. So you can also really educate patients to do these strategies at home. Deep tissue massage, they can do with 2 tennis balls inside of a sock, tie the ends off, and then they can roll out the affected forearm musculature. You can actually even teach them how to do instrument-assisted mobilization at home using a spoon, like the bowl edge of the spoon, or a tongue depressor. You can teach them put some lotion on and scrape in those areas or glide that skin or that tissue. So it's helpful to know what techniques are going to potentially be helpful for that patient and teach them how to do it at home so that they have some strategies to relieve pain even after their bout of therapy with you. Okay, now this next part I think is where we have truly the most power to help our patients, and that is in education. So we need to focus on activity modification, ergonomics and posture, teaching proper body mechanics. Those types of things are so crucial. Tendinitis is kind of like having a rock in your shoe, right? You can massage your foot, you can do all these stretches all day long, but if that aggravator, that rock, is still in the shoe, it's not going to get better, right? So we have to help people figure out what are the patterns, what things are triggering you, what does your posture look like, how is your environment set up. All of these things are so crucial. Are you, lifting things with one hand? Are your wrists in awkward positions? There's so many things that we can take a look at. You want to find the weak link in the chain, right? Maybe they're having some core instability or trunk instability, and so their arms are kind of compensating for that. Maybe their scapula is really weak on one side, their scapular muscles, or their rotator cuff is really weak on one side. Maybe they're just, in a desk chair all day, hunched over, and they don't have that good posture or that good, proprioception to know where their body is in space. We need to look at their daily activities, their occupation, their hobbies, anything that they might do, even if it's just housework or chores. What are they doing? Figure out some suggestions, adaptations, provide them with ideas for tools that might be helpful for them to modify their activity, teach them about posture, their ergonomics, setting up the proper environment, teach them body mechanics. Those things are so, so crucial. And we want to work with the patient to figure out what are your priorities, what things can we modify or adapt to make the stress overall less on your tissues. Next up is using braces or splints to provide support or rest for the tissues. It's also something really commonly used in wrist tendinitis, typically more in an acute phase, but it depends on the patient, it depends on the case. I think that sometimes braces and splints can be helpful, sometimes not, right? We have to really just figure out what's going to work best for each patient. Typically, braces can be helpful at nighttime to avoid awkward positioning or postures for several hours, but you can actually use them as retraining tools during the daytime. So if there are activities that bother your patient, sometimes it helps them to have the brace on for a couple of weeks during that activity because it literally forces them not to move in the aggravating position or posture. They have to relearn how to do the task while keeping their wrist in neutral position, which is really helpful for some people. You can also try kinesio tape. I've had a lot of good success with tape. People like it a lot of the time. I've had very few patients that didn't really care for it. They can do it to themselves. They like the way it feels, and I think that can also be a helpful implemented of treatment that you can try with patients. It's another tool to add to their kit. And then last but not least, the stretching or the exercises. So this is usually the part that your patients are going to come in. They're going to ask you, aren't there any stretches I can do? Aren't there any exercises I can do at home? So yes, there definitely are. I do think that stretching and exercise is an important part of any therapy program. I think it's an important part of daily life that most of us just aren't used to doing. I don't typically give wrist strengthening, necessarily. You might. Sometimes there are cases where that's appropriate. A lot of times it's figuring out what tissues are stiff, what tissues are imbalanced, and kind of working with each individual patient on either strengthening, stretching, or a little bit of both. There's no exact formula for the right stretch for everybody universally. It's just really dependent on each case. And we'll talk about some ideas for that in another part of this series. I think that developing a program that is individualized for the patient and also going to be something sustainable for them that they can continue with, especially stretching, right? Even after the tendinitis has resolved, that can be really important. And we need to make sure that our programs are simple enough and short enough that people don't get lost or overwhelmed. If you give someone 10 exercises, that might be really hard for them to keep track of, and they might just get overwhelmed and not do any of them. Versus if you prioritize 3 exercises, they might have a better success with that. So there's a lot of factors involved. Those are, in general, the principles of treatment of wrist tendinitis in a hand therapy setting in outpatient care. If I missed something, there are other treatments that you typically use or that you've seen used in a hand therapy outpatient practice, please comment them below. I would love to learn about that, and that way we can all build kind of our personal therapeutic toolkit for how we manage some of these conditions. So thank you guys so much for watching. Again, this is a 7-part series. This is part 2, so make sure you subscribe. Like the video if you enjoyed it, and follow along for the next few parts. See you soon.